Hello, everyone. So I want to talk to you for a few minutes about exosomes and hair restoration. This may be the new PRP for hair restoration. We have now introduced exosomes, and I want to tell you a little bit about them. Exosomes are a microvesicle. So basically, it's smaller than a cell, a lot smaller than a cell. It's actually not a cell that we're injecting. And these are obtained from FDA-approved biologic companies, and they are purified by those companies so that we can inject them for intracellular communication. Basically, it's not a cell, but it's going to help cells in the body communicate. And one of the big areas of excitement is hair restoration with exosomes, in addition to other areas. I mean, it's been historically used in orthopedics, anti-aging, a little bit in sexual wellness. That's a new and emerging area. And we'll explore that more in future videos. How do we get exosomes? There's a lot of research into companies that are big and are FDA-approved biologic companies. They are obtained from mesenchymal stem cells, but purified in the labs to just be the protein and growth factors from the stem cell. So we're not injecting a stem cell. It is basically proteins and about 200 growth factors in the exosome. So it's a more concentrated form of growth factors. And we're using those to inject into the scalp to stimulate the hair follicle to regrow hair. And so it really helps with hair thinning or balding areas. And exosomes show some promise in, number one, getting hair growth maybe earlier than PRP did, and also in receding hairlines, which PRP and PRF could not do. And again, we're really combining exosomes with PRF now, not PRP, because again, when we're injecting PRF, and we have other videos that talk about the difference between PRP and PRF, that it has no anticoagulant in it. So when we inject it, it's going to form a clot. That fibrin's going to keep all the platelets there, release growth factors over 7 to 10 days. And now the exosomes will also be trapped in that matrix of platelets. And so again, a slower release and hopefully, better and faster results with the PRF and the exosome combination. So again, whenever we're injecting the scalp, it could potentially, be painful. So we do multiple things to help with that. We can do a block that numbs it. We can do topical. We use a cooler that numbs and freezes the area as we're injecting. And we can also do a ring block around the area. We're going to tailor that to you to get you as comfortable as possible with any of our injectable procedures. And again, we use the injectable procedures often with our laser in combination for some pretty amazing hair restoration protocols here at Revitalize MD. And again, everything's always changing because as we learn more science and we learn about newer products, we want to implement those and use them in combination to support the hair follicle and growth, because again, it's a huge problem for both men and women with thinning and balding, and it affects our confidence as we approach the world each day. So we want to help you get re-stimulation of hair growth and feel more confident as you enter the world each and every day. Make an appointment and let us see if any of our hair restoration protocols would be right for you. And again, a lot of them are combining that PRF and exosomes and laser, and we have supplements, and we also have some peptides we use. So stay tuned or look at our Carelace and Care Factor page to hear more about the laser hair restoration. And again, make an appointment so we can help you with getting that healthy head of hair back.